Arthritis is one of the most misunderstood conditions in the world. Many people assume that joint pain, stiffness, or swelling is simply a normal part of getting older. But in reality, these could be early warning signs of arthritis, a disease that can permanently damage your joints if it's left untreated. In today's video, using research from top institutions like Johns Hopkins University, the Mayo Clinic, the Cleveland Clinic, and the NIH, we're going to uncover 12 symptoms of arthritis you should never ignore. If you notice several of these signs, especially if they last for more than a few weeks, it might be time to speak with your doctor. The first and most common symptom is persistent, ongoing joint pain. This isn't the kind of soreness you get after a workout. It's a deep, aching pain that continues even when you're resting. If your knees, hands, hips, or fingers hurt day after day, this could be the earliest step in the arthritis process. It's a sign that something more is happening inside the joint, and it's definitely worth paying attention to. Next is joint swelling or enlargement. Swelling happens when inflammatory fluid and thickened tissue build up inside the joint. You might notice the joint looking bigger, puffier, or rounder than it normally does. You might even feel that it's firmer to the touch or difficult to bend. If you have swelling that lasts for more than a few days, it's a definite red flag. Another important sign is warmth around the joint. When you touch the affected joint, does it feel warmer than the skin around it? This warmth happens because your blood flow increases as your immune system tries to fight off inflammation in that area. Warmth, without any injury, is often a clue that you might be dealing with early arthritis. Along with warmth, you might see redness or skin discoloration. When the blood vessels around your joint expand due to inflammation, the skin can turn red or appear darker than usual. This visible sign of inflammation is especially important if you haven't injured the area. When you see redness combined with pain and swelling, it's a strong indicator of active joint inflammation. Now let's talk about mornings. Many people feel a little stiff when they first wake up, and that's perfectly normal. But stiffness that lasts for more than 30 minutes, or even up to an hour, is a key sign of arthritis. This happens because inflammation builds up overnight while you're resting, making your joints feel like they're locked or stuck in place. You might also notice a reduced range of motion. Are you finding it harder to bend, stretch, rotate, or straighten your joints? If so, inflammation might be limiting how they're able to move. People often describe this feeling as their joints being tight, restricted, or just not moving as smoothly as they used to. This can make simple daily tasks much more difficult. Here's a sign doctors often check for: tenderness to touch or pressure. This is sometimes called joint line tenderness. If pressing lightly on your joint causes a sharp pain or sensitivity, that's a strong sign of underlying inflammation. Tenderness, even if you don't see any visible swelling, is a symptom that should never be dismissed. Some people experience a warm or burning sensation deep inside the joint. It's not on the skin, but a feeling of radiating heat coming from within. Even though this is a subjective feeling, it often reflects intense internal inflammation. This sensation is especially common in the early stages of rheumatoid arthritis and can be quite uncomfortable. Another huge clue is when symptoms appear on both sides of your body. Unlike an injury, which usually affects just one side, arthritis, especially autoimmune types like rheumatoid arthritis, often affects joints symmetrically. For example, you might feel it in both knees, both hands, both wrists, or both feet. This symmetry is one of the biggest clues that your joint issues might be autoimmune in nature. Keep in mind that arthritis doesn't just affect your joints. The inflammation it causes releases chemicals that can impact your entire body. You might experience constant tiredness, a slight fever that won't go away, or a general feeling of being unwell or drained. You might also notice low motivation or a sense of weakness. These symptoms can often appear weeks or even months before the joint pain becomes obvious. Another strong warning sign is joint inflammation without any clear cause. If your joint suddenly becomes painful, swollen, or stiff, and you didn't have an injury, a fall, or overuse it, that's something to take seriously. Unexplained joint inflammation often points to an underlying issue like autoimmune arthritis or chronic degenerative inflammation. Finally, there's what's known as the morning gel phenomenon. Many arthritis patients describe this feeling as their joints having gelled or frozen overnight. They feel completely stuck, and it takes some time for them to loosen up. This gel-like stiffness slowly improves as you start moving around, and it's another classic sign of inflammatory arthritis. So, what does all of this mean for you? A single symptom might not be alarming. But if you're experiencing multiple symptoms, or if your symptoms last for more than a few weeks, it's really important to see a healthcare professional. Arthritis is most treatable in its early stages. Getting an early diagnosis can help prevent permanent joint damage, reduce your pain, improve your mobility, and protect your long-term quality of life. Ignoring these early symptoms can lead to irreversible joint destruction. If you found this video helpful, please give it a like, share it with someone who might need it, and subscribe for more health education. Your joint health matters, and early awareness can make all the difference. Thanks for watching.